Welcome to Just Medicine. Shalom. I'm Michelle. Here we explore faith, law, and healthcare with honest conversations and practical insights. Today, let's talk about one of the most frustrating parts of healthcare, insurance denials. Have you ever had a doctor order tests only for your insurance company to deny them? You know how frustrating that is. In this video, we're taking a deeper dive into how to get around some of that frustration. Quick disclaimer, this is for informational purposes only and is not medical or legal advice. Plans vary, so always check with your insurance company and your doctor. Have you ever gotten that denial letter in the mail? It feels like a slap in the face, especially when your doctor says, "You really need those tests." Once the final denial letter comes in, the bills start piling up and your stress goes through the roof. So the big question is, what now? Let's walk through some real practical steps that you can actually take. Before you go to your appointment, write down your questions so that you don't forget them. Then, your doctor orders tests. Don't be afraid to ask follow-up questions. Things like, is this test really necessary? Or are you just being cautious? Will the results of the test change the treatment? Are there cheaper or less invasive options? And most importantly, does this test require prior authorization? Now you might be wondering, if your doctor ordered it, why would insurance deny it? Insurance companies typically deny claims for two main reasons: controlling costs and preventing fraud. The most common reason is not medically necessary. For example, your doctor may want to reset your broken nose, but the insurance company might consider that purely cosmetic. They can also deny if prior authorization wasn't obtained, or if they consider the treatment to be experimental. If your claim gets denied, don't panic. You still have several options. For example, you could ask your doctor to write a very strong letter of medical necessity. Request a peer-to-peer review where your doctor speaks directly to a physician at the insurance company. They speak the same language, so it often helps. You can also file a formal appeal through their website or request an expedited appeal if delaying the test may affect your health. However, sometimes it still makes more sense to just pay out of pocket. The cash price might be significantly lower than what the insurance company would charge, and if you haven't met your deductible yet, you're likely to end up paying anyway. So to recap, we talked about what questions to ask your doctor, why insurance companies deny claims, what you can do if you're denied, and when it might make sense to just pay out of pocket. May the Lord bring healing to your body, peace to your mind, and strength to your spirit. If this video blessed you, please leave a comment below. I'd love to hear from you. What tests have you had trouble getting covered? Have you ever had a claim denied before? Drop your thoughts in the comments and don't forget to subscribe. Shalom.